Tonight. Hi, everyone. Thank you so much for joining us. We're excited to have you all tonight to talk about Montgomery Goes Purple and to better engage the faith community around the topic of substance abuse. We really find that this is an important subject for our faith community because we know that you all are on the ground and working with those that really need love and support. So I wanted to do something specific for the faith community outside of the other Montgomery Goes Purple initiatives that are happening for this month. And during the presentation, I'll put more information about Montgomery Goes Purple for you all so that you can tune into other events and things that are happening around the community. Before I hand it off to our speaker today, I want to give you a couple announcements. We're going to have a House of Worship security training on the 12th, so Monday at 7 p.m. I'll also put a link to register for folks that are interested. Our next town hall is going to be on September 13th, also at 7 p.m. And that will be virtual. And that's going to be with Interfaith Works. So they're going to share about their initiatives and volunteer opportunities. And then we're going to have the Friendship Picnic on September 18th. They have this event every single year, but it's amazing. They have thousands of people who show up and it's at Wheaton Park. It's free food and it's just a lot of fun. So I'll be sure to include all of that, but I hope you guys are able to join us for those upcoming events. But without further ado, I want to hand it off to our incredible speaker, Ben Stevenson II. He's our Prevention and Harm Reduction Manager with the Department of Health and Human Services. And he gives presentations like this one all the time to help make sure that our community is aware of substance abuse and ways that our community can have a positive impact on others. So Ben, I'm going to hand it off to you.
All right. Thank you, Kate. Good evening, everyone. It's a pleasure to be with you this evening. Again, my name is Ben Stevenson II. I always put my suffix in my name just because there's actually two Ben Stevensons that work with the county government. So the other Ben Stevenson works with Department of Corrections and I'm with Department of Health and Human Services. So usually when he gets my emails or I get his emails, we just kind of chuckle and laugh and send them to each other and say, hey, I think this is for you. So, but I'm happy to be with you. So again, I am the Prevention and Harm Reduction Manager for Montgomery County. I oversee all of our prevention, education, and awareness efforts, which includes a lot of community awareness campaigns that we do around like substance use prevention related to like educating the community about fentanyl, as well as educating about the dangers of or the proper ways of safe storage of prescription medications, effective ways of disposal of medications to prevent or decrease access to those medications. And then I also oversee a youth ambassadors program. So we have some very impactful young people in the community that are very interested in using their voices around substance use prevention, around suicide prevention, as well as mental wellness. So we pretty much try to train those young people up about, in different leadership skills related to those different topics. And what they'll do is they'll educate their peers. So last year they had the opportunity of doing that at a big forum that one of our local councils hosted. So without further ado, I'm going to go ahead and get into my presentation. In addition, I also oversee all of our harm reduction services, which includes our Narcan training and distribution program. So we are looking to train as many people as possible in that area, just, it's because it's a life-saving tool. We also have a syringe services program. So if anyone dealing with substance use disorder and needs support around in harm reduction, we have, we provide different supports around like free HIV testing and things like that. And then we also do fentanyl test strip distribution. So, which I'll talk about in a moment because a lot of our overdoses in the county are fentanyl related. So we try to educate around fentanyl test strips, using it as a life-saving tool, a preventative measure as well, which I'll talk about a little bit later as well. So let me go ahead and pull up my presentation. Right. Because it seemed like I was actually about to give you the whole presentation without showing it. So let me go ahead and share that with you. So I think you should be able to see my screen. All right, so basically what my presentation is going to cover, we're going to talk about what is an opioid. We'll do an overview of opioid-related statistics pertinent to Montgomery County. We'll talk a little bit about the cycle of addictions just because I think that's important for the conversation. We'll talk about current efforts to address the problem in the county, and then I'll kind of speak to some, potential efforts the faith-based community could potentially get involved in when it comes to addressing this issue in our community. So a lot of times I ask people, what is an opioid? But I'm just going to share some insights about this information for you here. So opioids are pretty much any drugs that contain opium or its derivative. They're natural or synthetic. They can come in prescription medications or illegal drugs. So your illegal drugs is like your heroin, your fentanyl, and things like that. You also have pills, capsules, powder, or liquid, and can be swallowed, drunk, smoked, snorted, or injected. Um, thinking of your different opioids, so like opiates are your natural form of opioids, and your opioids are typically your synthetic derivatives. So an example of an opiate is morphine, morphine and codeine. An example of an opioid is fentanyl, which is a lot of what we see today in the community. All right. So opioids are typically used to manage pain, suppress coughs, and treat opioid use disorders. Can cause feelings of euphoria, contentment, or detachment. And the effects of these drugs can last in the body between 3 to 24 hours. So a lot of times in excessive amounts, opioids suppresses a person's urge to breathe, which is the reason why a lot of people experience those overdose symptoms that we hear about a lot. Unfortunately, hear about a lot. So like your immediate release medications, such as like oxycodone, hydrocodone, those typically last in the body about 4 to 6 hours. Then you got extended release medications like Oxycontin and morphine, which you might get from the ER, which can last in the body about 12 to 24 hours. And then you got heroin, which usually lasts in the body for about 3 to 5 hours. This here are just some examples of common prescription medications, prescription opioid medications. So you have your oxycodone, your morphine, hydrocodone, oxymorphone, hydromorphone, and codeine. So oxycodone is actually the most commonly misused and abused prescription drug in the United States. Hydrocodone, you typically might get it prescribed like if you have like a tooth extraction or your tonsil surgeries or something like that. Um, then you also have like morphine is your base drug that all other medications are typically compared. So thinking in terms of potency, um, morph heroin is about 3 to 50 times stronger than morphine. Fentanyl is 100 times stronger than morphine, and then you got carfentanil, which is 10,000 times stronger than morphine. So carfentanil is basically like an animal tranquilizer used on like big game animals by veterinarians and things like that. So they might use it on an elephant or some big animal to put it to sleep while they might perform surgery. Then you have your codeine, which is heard a lot in popular music, which is your prescription strength cough medicine that is prescribed by a doctor. It could be mixed with like a soda or some kind of candy or something to mask the nasty flavor. But people will mix it with a soda or something like that, and they'll just kind of drink on it. Um, and then you also have like, medications, opioid medications that are typically used to treat opioid use disorder, like methadone. You got buprenorphine or Suboxone, or even things like Subutex, which also helps to treat opioid use disorder as well. This image here, I typically put it in my presentations just to give a clear depiction of the lethal doses of heroin and the lethal dose of fentanyl. So you can see a clear distinction between the two, where it does not take a lot of fentanyl to actually kill a person, and it still doesn't take a lot of heroin to kill a person either. But a lot of the supply that is out these days is laced with fentanyl because it's so cheap. And when people get addicted to like the prescription medications and they're hard to get because of the costs and things like that, they may venture into the world of using these street drugs, which are harmful on the body and pretty much takes lives. So looking at the Montgomery County opioid statistics, so I wanted to share a slide about the pain pills ordered by Montgomery County pharmacies within the county. So this information was posted by the Washington Post, and it looked at the 6-year window of 2006 all the way to 2012. And you can see how high the numbers jumped in regards in the millions. They were already in the millions in 2006, but you can see how it jumped. At least 5 million additional pills being ordered by pharmacies in Montgomery County. So since 2016, like the Washington Post did like an investigation on opioid epidemic that pretty much kind of, just really ravaged communities and claimed over 500,000 lives nationwide. And so this investigation and the work that they did is more so known as like the opioid files. So you could actually Google the opioid files and it'll pull up the research and all of the intricate information that the Washington Post kind of put out. I also want to share as well, there was a documentary that came out in May 2021 by HBO called The Crime of the Century, which was a 2-part documentary, which was a 4-hour documentary tracing the beginning of the opioid epidemic in America and focusing on the role of drug companies and that initiated and fueled it. So looking at like Purdue and all the other big pharmaceutical companies that were selling, these high-powered and potent opioid medications in communities across the country. So looking at our numbers for overdoses in Montgomery County. So in 2020, we unfortunately lost 139 people to overdoses in Montgomery County. We had naloxone was administered to 521 individuals in Montgomery County, and 492 lives were saved by administering naloxone in the county. Of those that we lost, 108 overdose fatalities were due to opioids, which was an increase of 25.6% since 2019. In 2021, we lost 158 lives to overdose deaths in Montgomery County, and 624 naloxone administrations, and then we saved 605 lives saved by Narcan administration in the county. Now, these numbers are calendar year numbers, but thinking in terms of what drugs account for a lot of these overdose deaths that we're seeing, about 80% of all of our fatal overdose deaths in the county are fentanyl related. So that could be someone using cocaine that's laced with fentanyl. That could be them using heroin laced with fentanyl. That's them thinking that they're buying a Percocet or Oxycontin or an ecstasy pill or some other kind of pill, and it's being laced with fentanyl. Like I recently got some information from like our local law enforcement partners that received an alert from DEA about how drug pushers are creating prescription looking medications to look like almost like the Flintstone vitamins that I used to use as a kid, because they're all colorful and everything, but they're pure fentanyl tablets. And the fear is that kids could get their hands on these, and that others can get their hands on these types of medications just because they don't know what's in it. They don't know what it is. And someone can say, hey, this is just an Oxycontin, but it's something else in it as well. So looking at like the cycle of addiction, there's a lot of misconceptions when it comes to like substance use disorder and addiction. And to really define a substance use disorder or addiction, we first kind of need to address like what it is not. So addiction is not a lack of willpower. So a person can't simply just stop using. This is, wouldn't technically be considered an addiction. It really alters and impacts the brain, which leads, to the addiction. And the use of substances, just really alters a person. Addiction is also not a moral failing. So there's so much stigma around addiction. The old and outdated approaches to understanding substance use disorder, placing blame and judgment on people who develop, these disorders. And we've learned, a lot more from, about like shame and blame, technically prevents people from reaching out and getting help. And then addiction is also not a sign of a bad person or a bad family. Addiction is just, it does not discriminate. It affects about 10% of the entire population, but impacts all races, all genders, all socioeconomic classes. It doesn't discriminate against anyone. Anyone can be impacted either directly or indirectly by addiction. So looking at addiction, NIDA put out a definition. So it's basically a chronic relapsing brain disorder that results in compulsive drug use and continues despite negative consequences. So one thing to keep in mind is addiction is chronic and relapsing, and it's similar to many, medical diagnoses like heart disease, like diabetes. Relapse or return to symptoms is a part of the recovery process. So it's really a brain disorder. So mind altering, mood disorder, just really impacting a person's or hijacking a person's reward center, making them feel, less of a person, and they feeling as if they need more and more of that substance to feel like a normal person. And then also associated with addiction is like the negative consequences. That's one key component of substance use disorder. When our use continues, even when the negative consequences happen, use might still continue. So addiction contains two basic qualities: difficulty with controlling the use, and then continued use despite those negative consequences. So addiction involves, those complex interactions among the brain circuits, the genetics, the environment, and even the individual's life experiences, which we'll talk about in a moment. So looking at factors that contribute to addiction. So you have like half of it could be like the family history. So the immediate and extended, family history. Personality, having that impulsiveness, low frustration tolerance. So not being able to handle frustration or stress, risk taking, as well as mental concerns. So depression, anxiety, ADHD, etc., are other potential risk factors. Then also looking at the environment, so like the family relationships, so your home, a person's home life, there's the level of supervision is a could be a risk factor, but also could be a protective factor. Looking at the peer in school, so the influence, the connections at a young person's school, community connections, so availability of substances. So we all in prevention, we talk a lot about social access, so having access to it in social settings, or retail access, being able to buy it and things like that. We also talk about attitudes and norms, so having those positive attitudes about the community norms. And with community norms, is it acceptable? Is it something that is just overlooked or brushed up under the rug? And then you also have to look at trauma in childhood as well. So these are considered like your adverse childhood experiences. So like household concerns such as like mental health, substance use concerns of parents. A lot of people don't think about divorce, neglect, or even abuse as some of those childhood traumas that young people or people may experience and never are dealt with, but they kind of lingers on throughout their life. So it's known that a person that has like a 4 or more score within the ACEs are 5 times more likely to misuse alcohol. A person who has 5 or more um, checks in their ACEs score is 7 to 10 times more likely to use an illicit drug. And then a person with 6 or more in their ACEs score has 46 times more likely to use drugs intravenously or via IV use or something like that. So additional factors that can contribute is age of first use. So more than 90% of people with addiction or with a substance use disorder started to use substances before the age of 18. Frequent use. So more frequent use typically, increases potential for substance use disorder. Particularly like the first time, is enough to kick off addiction, but then, that genetics and the predisposition and things like that can come into factor and impact that as well. And then the potency of the substance. So the drug type, the strength, the dose, so the amount that a person has used. And then looking at like the stages of addiction. So the first stage is the experimentation stage. So this is the initial use of any kind of mind altering substances, um, where they're experimenting and seeing if seeing how it feels and things like that. Stage two is like your social use, so social and regular use, so using the substance in like those socially environments, social reasons. I might having social anxiety and feeling like you got to use a substance to feel comfortable in it in a certain environment. You know, they may feel some negative consequences during this time, and they may not as well. So some, negative consequences could be like hangovers from this stage. Stage three is your, risk and harmful use. So beginning to use to experience some problems related to use associated with like feelings of guilt, irritability, relationships may be impacted, putting yourself in danger, like driving under the influence or using while you're, operating a motor vehicle or something like that. And then stage four use is, any effort to, manage or control is unsuccessful. So you're using regardless of those negative consequences, and you're having the breakdowns in a relationship. You might lose a job behind your use, marital, material possessions. A lot of times I tell young people, if you wake up in the morning and feel like you have to use before your day gets started, then that's dependence. That you're dependent on that substance to get through your day. So that's a sign of, of addiction there. So what are the efforts that we're doing in Montgomery County to try to address substance use disorder in our community and try to, elevate the community to be a lot healthier place to live? So in prevention, just like I said, I do a lot of prevention work in the county, in which we have a lot of partnerships with a lot of, we have partnerships within DHHS as well as with local agencies. We do a lot of community awareness campaigns. So around like the dangers around the non-medical use of prescription drugs. So really educating young people about those dangers of those drugs, as well as educating about the dangers of underage drinking. We have an agency in the county that does a program for parents that targets like parents of preschool age youth, which it's called Dare to Be You. So it basically helps to keep families engaged, educate them about delaying or preventing the onset of use of substances within their family, to help just build a family connectedness and things like that. We also, like I indicated, we do a lot of efforts around safe storage and disposal. So we work with our law enforcement partners who have safe storage sites throughout the county. I want to say we have close to 16 when we do our drug take back days in October, as well as we do one in April. And then, we also have a mobile drug take back box. So if, any churches or faith community organizations would like to host a take back day at their place of worship, we could bring the mobile box and have one of our law enforcement partners come by and kind of help us manage that box as well, because law enforcement has to be involved because they're the ones that typically do the disposing of it. We typically do a lot of the marketing behind educating people about safe storage, the importance of locking up your medications to eliminate access from young people to access those different substances, and disposing of unused and old medications as well. And then another thing strategy or activity we started last year was our youth ambassadors program, which is kind of funneled through our efforts with Be the One, which has a component which educates around not only substance use prevention, but also suicide prevention, as well as mental wellness. And just like I was saying earlier, we had a very strong nucleus of young people who really wanted to use their voice to educate their peers around the importance of not using substances and the importance of supporting a friend or knowing where to go for supports and help when it comes to dealing with like mental stress and things like that. So these young people actually had the opportunity to put on a presentation for about 100 young people from across the county to educate them about, Be the One, about the signs and symptoms of substance use in a friend, and the signs and symptoms of stress and depression and anxiety and things like that. And then they also equip them and help them to learn about steps and strategies and places they could go to get supports and help and things like that. And then also they encourage them to just kind of get involved in the community. A lot of times, one of the major things that we can do to impact, reducing stigma in our community is getting involved in some of these efforts, and they definitely encourage their peers to do just that, get involved. Next, what we do in the county, we also have harm reduction efforts. So our Narcan training program, we provide training the fourth Tuesday of every month, which is a virtual training which a person can attend. And once they attend the training, we actually will deliver a Narcan kit to them, or we will ship a Narcan kit to them. So once they get trained, we'll provide a kit on the spot. And Narcan is basically the life-saving tool that can help reverse an opioid overdose. So if someone is overdosing and they're not breathing, it's the nasal spray that a person could actually be administered to, hopefully be revived and hopefully to sustain their life. We've done a lot of effort and a lot of work around Narcan saturation in the community. So making sure that Narcan is in a lot of different places. So a person can access Narcan at the fire and rescue stations in Montgomery County. So they could pretty much walk in and say, hey, I'm interested in having Narcan either for myself or for someone else. And they would give them a kit and right there on the spot. Even at all of the park and rec locations within Montgomery County, there's Narcan within those facilities as well, because we trained all of their staff. We've trained staff at all of the high schools, middle schools, and elementary schools. So the school health nurses are trained up in Narcan administration in all those locations. And then we're currently, working in a partnership with Department of Transportation in Montgomery County to train all the ride-on bus drivers in the county and bus operators in the county as well. And then we're also looking to expand and train bars and restaurants, hotel staff, because you just never know if you might be in a position to administer Narcan on someone who is overdosing. I heard a story last week where a person went to a gas station just to simply put gas in their car and walked in the store, and someone in the store was overdosing, and luckily they had a Narcan kit in their car. So they ran to their car, got the Narcan kit, and pretty much saved this person's life. Contacted 911, got 911 there, administered the Narcan, did the rescue breathing and everything like that, and that person was able to sustain life. So a lot of times we never know what kind of position we may be in to save a life as well. Also, with our efforts, we have a leave behind effort partnership with our fire and rescue as well. So the kits at the fire stations. But in addition to that, when someone overdoses and it's a non-fatal overdose call, they also leave Narcan kits with the family or with the victim, just in case they experience an overdose again. And then I also spoke about our syringe services program, which we provide free harm reduction supplies in the community. We also provide wound care services. We have a nurse on staff who's capable of caring for a person who might have, abscesses and wounds from their use, but also teaching them how to take care of the wounds themselves as well, and then connecting them with other services and supports. And then we also provide free HIV testing, which is something we're excited about. So that's something, the faith-based community could, partner on as well, providing free HIV testing at their places of worship. And then we also distribute fentanyl test strips in the community. So just like I was speaking on how fentanyl test strips are preventative measures, so a person could actually test their substance before they use it to know if it's laced with fentanyl or not. And that will hopefully help, get them to either go slow or decrease the amount they might use, just to hopefully prevent them from experiencing that overdose. And then we work in partnership with a program in the county called STEER, which is Stop, Triage, Engage, Educate, and Rehabilitate, which this is a group of peer support specialists who are deployed out to overdose scenes and things like that, or to the hospital to engage with victims who have experienced an overdose and try to get them, connected with a peer support specialist, get them connected with services, and potentially get them, try to, build a rapport and relationship to try to get them to a place of wanting to pursue their treatment and recovery. So that's some of the services and things that we provide around harm reduction. And then in the treatment space, DHS offers, just a variety of programs for youth and adults with substance use and mental concerns. And they provide, assessments and treatment services. There's a child and adolescent assessment services, which offers free screenings for mental health and substance use concerns for youth living in the county. And then if, someone is struggling or in crisis, we know we have that 988 call and text line now that a person can call or text, or just to chat on the 988lifeline.org as well. And then other partnerships and additional efforts include like the in-service stuff that happens in schools. So we partner a lot with our school wellness centers. We partner with, the mental health programs in the county. So like linkages to learning and things like that. I was already spoke on like treatment and recovery supports that we partner with, and then just the partnerships that we have with law enforcement and EMS as well. So thinking in terms of what the faith-based community could do in regards of their contribution to addressing this issue, is some of the things they could do is provide. So providing education and activities for youth and families can go a long way, where it could include education about Narcan, or education about family connectedness and things like that. Hosting or increasing access to interventions and recovery support. So some faith-based communities or organizations are open to hosting recovery meetings and things like that, or hosting like this during the month of September, which is Montgomery Goes Purple, as well as Recovery Month. We have a church that's actually hosting a Narcan training and distribution on a Saturday in partnership with us. And then also educating staff and the community members about substance use disorder and recovery. Just educating about, what to look for, the signs and symptoms and things like that. What to, just having that conversation can definitely go a long way with decreasing the stigma that we experience when it comes to discussing mental health and substance use disorder as well. And that's a key piece to addressing this issue in our community, is addressing the stigma that's associated with those two different things that we experience, and then just create opportunities for awareness and decrease stigma through just like the open dialogues and collaboration, which I mentioned. And then some potential action steps that could be taken. So developing a plan. So they're actually SAMHSA and other organizations have developed toolkits and other resources that faith-based organizations can use to address and respond to the opioid crisis, which I'll make sure I share with Kate so that she can share, amongst you all. And then also assessing the knowledge and experience of your faith communities, utilizing like polling tools and things like that to see if your members or congregation has knowledge and experience in these areas. And then start the conversation. That's just a valuable first step of having faith leaders, lead, discussions around, addiction and substance use disorder, or even having addiction ministry, or saying the right words. A lot of times, people may use the right words when they talk about substance use disorder or addiction. For instance, like a word that the field is really moving away from is calling someone an addict. You typically now would hear someone say a person who uses drugs, or someone with the substance use disorder, or something like that, because we know that some of those terms are negative in connotation. Identifying resources available. So hopefully this begins that spark of, helping to identify resources that you might have access to, train up your faith-based organization or the members in your congregation, and then show how substance use ministry fits in the faith-based community. I think when it comes from a faith-based leader, that can go a long way in showing how it fits, embracing the role. Some faith-based organizations have created spiritual emergency rooms where, a person can come and get supports around mental health and substance use. Identifying, unique opportunities, such as like honoring like Substance Use Awareness Month, which happens in October, and National Recovery Month, which happens in September. And then just learning from families and using, some peer supports, because I think people with lived experience are invaluable when it comes to educating, and because they've been down that journey, and they're still going down that journey, and they can, reach back and educate the others so that they don't have to go down that path as well. All right, so that is mainly, my presentation, and I didn't want to, bore you or anything like that. I wanted to make sure I shared some pertinent information that you left here that you could use. And so at this time is I'm opening the floor for, any questions you might have had. I didn't get a chance to monitor the chat, so I'll click on that in a moment. And then I also wanted to share my contact information, just because I kind of consider myself a resource in the community. So I'm definitely willing to open the door and dialogue and things like that. And then if you're not a part of like a community coalition, I encourage you to join one. Currently in Montgomery County, there's the Montgomery County Prevention Alliance, which works on substance use disorder issues and things like that in the prevention space. And then if you're interested in addressing like mental health and suicide, there's also a suicide prevention coalition in the county as well. So those are two opportunities to kind of get involved, get engaged, and just I kind of say just kind of get your elbows dirty and help out with some of the efforts that are going on in the county. So I'm going to stop there and open the floor for any questions that you might have.
Thank you so much, Ben. Everybody, please notice the two I's in his email signature so you don't email the other Ben like you mentioned earlier. I'm going to encourage you all to unmute yourselves and ask questions or use the chat, whatever is more comfortable for you. I do see Reverend Courtney Miller put in the chat, do you have a virtual background I can use for my Sunday worship? That's a good question. Like some sort of digital toolkit.
Yeah, so there is a digital toolkit that was put out by there's an organization, well, it's a group called the Opioid Response Network. And that's the toolkit I'm actually going to share with you all, which has a wealth of information on, how what the landscape of the opioid epidemic looks like, or with the opioid crisis, how you can possibly start some efforts in your church or faith-based organizations and things like that. And there's a clear image of what it could of that toolkit. So I could share that. And then I'm definitely willing to share, I mean, if there's any images from my presentation that you're interested in using, I'm definitely willing to share those as well.
Thank you. I see that Amjad Chaudhry unmuted from the Ahmadiyya community. Do you have a question?
Yes. May I ask you that, the marijuana use is increasing. Many people, they give their dogs and cats also a product of marijuana. And is that a way that they can get into opioid?
Yeah, so I'll say for years and years, a lot of people viewed marijuana as one of the gateways, in a sense. And they kind of coupled it with alcohol, marijuana, tobacco, and things like that as starting points. And so now you have those conversations where you potentially have things moving from legalization for medical purposes to potential legalization for recreational purposes and things like that, which really is kind of causing some challenges when it comes to like people in like the professional work that I do around like educating about the dangers of these substances. Yes, they are addictive, and they have, you might not have like some negative physical consequences immediately, but they, can experience those down the road. And then, we've heard of instances as of late of which I'm still, the jury is still out about this, but marijuana potentially being laced with fentanyl. And when it comes to like these different drugs that are on the street now, you don't necessarily know what you're getting anymore. That's the scariness of it. Like, a person might think, oh yeah, I'm just getting marijuana, but they might get marijuana that's laced with something else, and they don't know what's in there. And then they smoke it, and then next thing you know, they're like, okay, they've experienced something wow that they didn't even think think about, and now it's causing them to seek and pursue the use of that substance again, or they're pursuing that same high that they got that first time. So a lot of times when I talk to young people, I talk about how dangerous it is, one, to you know, these high power medications that are prescribed by doctors, but then thinking that you can get that same drug off the street from someone that you don't even know. So I think when it comes to marijuana, I think the conversation is still the same. It still has some negative connotations with it, but and I'm sorry, I make sure I try to use the right terminology. So we typically call it cannabis now, so that's the politically correct term that when people use to refer to marijuana now, because of the negative connotation of the term marijuana. But cannabis, is still viewed as a gateway. But just like I was speaking earlier about those social norms, it's so acceptable, and people overlook the smell of it. And you can, I mean, go to the store now and walk past someone, they smell just like they just got out of a car from smoking, and you like, okay, instead of smelling cologne, you're smelling cannabis cologne nowadays. So so it's definitely challenging in the work that I do.
So one other thing that is the doctors are responsible for doing some dispensing these opioid and these things more frequently, and not thinking of what the consequences will be.
Well, I will say this. I will commend the medical community, because they've done a lot of work in regards of changing how they address or how they dispense these medications. I mean, you might still have your sprinkle of doctors here or there that might still like overly prescribing, but then you do have a lot that are not doing those types of things, which I definitely commend them, and they're looking at alternatives to addressing a patient's pain and things like that, and figuring out ways to help them find their new normal, because maybe the pain will never go away, but they can find a way to manage it and kind of deal with it in a more safer way versus using those types of medications. I think, and this is just my opinion, this is not the opinion of the county or anything like that, but I think, for, if you think about it, if you look at years and years and years of of medication production and prescribing, I think physicians and prescribers were lied to, just like like the community was lied to. We weren't given the amount of information to let us know that these substances could be dangerous. A lot of, like, I worked in substance use in a treatment medication assisted treatment program for a year. And in that time, a lot of my patients talked about, or a lot of my clients talked about, how they went for a broken ankle, or they went for this or a back problem or something, and they got hooked on these medications. And then the doctor realized, oh, they're addicted, they're dependent on these medications now. So now I have to pull back on prescribing. And then next thing you know, they ventured into looking for those street drugs, the heroin and the other drugs, to kind of supplement. Because I don't think they necessarily wanted to be dependent on those substances, but the withdrawal symptoms are so harsh that they're like, I just don't want to be sick. And so I will say, as far as the state of Maryland, they've done a lot of work in regards of requiring, the medical community to get like continuing medical education hours around opioid prescribing. I think the medical community has done a lot of work around, reducing the amount that they're prescribing, but also I've seen a lot of doctors take the steps of trying to get educated on, addictions and dependency and things like that, so that they could know how to help their patients, or connecting with other doctors to help manage patients and things like that. So I would, right, thank you, Angela, you put a great tool in the chat box. The PDMP requires medical professionals to actually input data into the system to let them know who's being prescribed what medications, so to prevent patients from doctor shopping or going to multiple pharmacies to try to get prescriptions and things like that filled. So there's a lot of work or preventative measures that have been done in that space to try to prevent, what was happening years and years ago.
Thank you, Ben and Amjad. Emma, I saw that you unmuted yourself. Do you have a question?
Yes, I do. Ben, thank you for your presentation. It was excellent. My question is, legally, how do you protect yourself from using the kit on someone? Because what are we covered? What
Yeah.
are we covered under? That's
All right. So I'm glad you asked that question, and maybe I should have did an actual Narcan training at this meeting, or maybe we can do that at a later date. But when a person is trained or has a Narcan kit, because actually in the state of Maryland, it's not required to get trained, but we still do training as a part of our grant requirement or whatnot. So when you're trained or you have Narcan and you're actively assisting someone in a medical emergency, a person is protected under what they call the Good Samaritan law, which
okay.
protects a person from persecution or anything when they're actively trying to help someone who's in a medical crisis. And this not only includes a person who's experiencing an opioid use disorder, but it could be a person experiencing like alcohol poisoning or something like that. And that was another attribute that they added to that law, because there was a lot of instances where you had kids underage drinking, one of their friends pass out, and they'll just drop them off at home and leave them and won't say nothing or anything like that, and the kid passes away, unfortunately. So so the Good Samaritan law protects a person who is actively assisting someone experiencing that medical crisis, and it doesn't protect anyone who is just witnessing it. So like a person who might have been in the space or using with the person who is experiencing the crisis, and they're just there not actively helping, it doesn't necessarily protect them if they have like previous charges and things like that. But there are actual a lot of previous charges, or if a person is experiencing like pretrial or something like that, it'll protect them from persecution. Yeah.
Okay. Thank you.
Great question. Thank you for asking that
appreciate
question.
that.
Yeah.
Yeah, because I do a lot of volunteer, and I was thinking about taking the training, but I was like, I don't know, because
Yeah.
because of that. And I know I'm covered under the HIPAA law under the Good Samaritan law by my volunteering that I do right now with the county and stuff like that. But I just wanted to see how that applied to this. But I do appreciate you answering that question.
You're welcome. I'm going to actually put the Narcan training registration link in the chat box, just in case you're interested. We provide, just like I said, we provide those trainings the fourth Tuesday of each month. But then we also will do like a lunch and learn on a Wednesday, like the second week of the month. This month, we're actually doing, I think, over 12 trainings, I think, over the next couple weeks, some being provided specifically in partnership with Rockville Goes Purple. So they're doing a lot of efforts in regards to training on Narcan and things like that. But if, let's say, you wanted to host a training at your faith-based organization and you wanted to do it on a Saturday, or we could possibly come to a Wednesday Bible study if you like to do it during that time, because the training typically only takes about 30 minutes, and then we could probably leave a kit right there or leave kits for anyone who would like to have one on the spot, for just in case. You just never know if you're in a position to save a life. So.
And that's something we can consider also for future town hall if helpful. Amjad, did you have a question?
Actually, I was going to ask you that in November or December, can we have some training in Bethlehem on mosque? Maybe on some Saturday.
Yeah, we could surely do that. I'll make sure I put my email in here, and if you like to email me directly, we can get that set up. I'll connect you with my team that kind of helps coordinate a lot of our trainings, and then we could find a Saturday morning or something, and we could definitely come out and do that.
Great, that's great. Actually, our community, Muslim community, they have a lot of training and these things that goes on, and I don't know, they have more emphasis on opioid and drugs,
Mm.
but they want to prevent these things. Thank you very much.
Oh, no problem.
I-
No problem at all.
This is Emma again. I do have one other question. Say I was trained in Montgomery County, but I
Mhm.
experienced the emergency in Frederick County. Can I still use that in Frederick County or any other state or whatever?
Yes, you will be covered. Pretty much, the Good Samaritan law is I want to say it's national. It's in pretty much every state across the country. Every state has a Good Samaritan law, and long as you, I mean, it's if you're anywhere in the state. I know for sure if you're anywhere in the state of Maryland and you have a kid and you have to and you're saving a life, you'll be protected. Just because every jurisdiction in Maryland that gets Narcan, they get it from the state, and so you'll be protected under that law.
Okay, thanks. I was just wondering.
You're welcome.
Lori, do you have a question?
Yes, I'm the chair of the Equity and Justice Committee at the Church of the Ascension, Episcopal Church of the Ascension in Gaithersburg. Our committee has already had a discussion about how do we help people if we should see someone who needs this kind of help. So I think we'll be very interested in doing a training. We also like to collaborate with other faith communities. So to save you time, Ben, we'd be very happy to come somewhere nearby if some other faith community is having a training. So I'll put our information in the chat if anybody wants to take us up on that, or come to our church too, if you'd like. That's easier. I wanted to make an admission. I'm very sheepishly because it's a little embarrassing, but I think it might be useful. When I was listening, I was thinking, oh yeah, we really want to get involved in all these different ways. And I was getting very enthusiastic about it, particularly because of the setting of our church where we're located. It could be very useful probably to the community at large because, we probably don't have a problem within our congregation. And then I thought, am I sure about that? And I thought, I need to wake up, and I think it would be really good to do a survey and see what is happening right in our own congregation. And so we'll be in touch for sure.
Actually, I have a comment that because the people who come to church or come to the mosque, they don't have any problem. But the people who stay at home, usually that's where the problem is. They usually don't come to church or don't come to the mosque, and that's what when we are doing some training of these things, and we always laugh about this, that those people who are coming here always get the training, but those people who need training, they are sitting at home, but they don't get the training.
And I think to go back to what Lori said, I think I disagree. I had a cousin who had one point had 8 different prescriptions for different medications and was still going to church on Sunday. I think the opioid crisis is something that impacts most families, and that's what was so wonderful about the vigil that we had last week, is that there are just so many folks of different ages that were there, and it's just really, it's nice to know that other people have gone through similar experiences, but it's also devastating because you just don't know who all is impacted. I'm sure Ben has met people from all walks of life who've been impacted.
Yeah, I will say, a lot of times you never know a person is actually dealing with it or struggling, because you might overlook or you might miss the signs, and they could still be doing the same things that they might do on a regular basis. They might come to the mosque and they might come to church, and they might still try to engage because they're trying to still lead a semi or so, or what we all, I guess, consider a normal life or whatnot, but they might still be in the background dealing with like pain and taking these medications and things like that. Like we've had accidental overdoses with our older adults in the community, who have, who are dealing with pain and different things like that. And they might have forgot that they had taken their medication and took it again, kind of thing. So, there's a wide range of people that are impacted, and we might not necessarily know that what they're dealing with, even with, like, for instance, when I was growing up, um, in my community, there was a lot of stigma around mental health and things like that. And so, if you're depressed, you don't get depressed or you get mad or angry, you go to church. That's what I was taught growing up. You go to church, you pray about it, and then everything will be okay. But that in actuality is not necessarily always, it's not true. It might work for some, but someone might have to take it a step further and say, okay, God bless this person with these skills, or my higher power bless this person with these skills as a therapist. Maybe I should go talk to them. So understanding that and helping to reduce, like, it's okay to talk to someone, because a lot of times these people are in positions where they're non-judgmental and they're a neutral party and they're just there to support. But a lot of times, in families, in some cultures, they're like, well, you don't put your private business out in the street. You don't tell these people what's going on with you. I remember, growing up, mom would always say, hey, don't tell people what's going on in our house and things like that. But I'm like, well, mom, we're struggling with, we might not have food tonight, or the power got cut off or something like that. So, it's different, just understanding or breaking down those levels of stigma and getting to a place where people are comfortable in saying, hey, if I go to my mosque, or if I go to my church, or if I go to my place of worship, I know that there's going to be someone there that's going to support me and encourage me and help me, and they might know some resources to point me in the direction of getting the supports I might need. But if we don't have those conversations, then they might not feel comfortable opening it up about what's going on. And I think that's where we need to get to a place of breaking down those walls and opening those doors for those conversations, that people are saying, hey, I can go to my place of worship to get help. And I think we do that in a lot of different aspects. A lot of people are like, hey, if I'm dealing with the money issue, maybe my church or my place of worship can help me. If I'm dealing with food, my place of worship can help me. If I'm homeless, if I need clothes. But when it comes to mental health and substance use, there's a lot of stigma around it. And I think as the faith community, as a community in general, we just have to break down that wall to get to a place of people feeling comfortable saying, hey, I need help and this is what's going on.
Thank you, Ben.
Sorry, I got on my soapbox, but yeah.
No, we appreciate it. And we're almost at the end of time, but I know Irvi has a question I wanted to ask. And so if anybody else has questions, please use the chat, and then I'll close out after Irvi's question.
Yes, my question is that you mentioned one of the resource as youth support team or youth buddy system.
Oh.
Can you tell a little more about it? And if we get a group of youth who is interested in helping out, what do they actually have to do, and how does it work?
Yeah, so I was speaking about our youth ambassadors program, and so it's kind of titled the Be the One Youth Ambassadors Program, because we look at the Be the One mantra as a way of empowering young people to use their voice to educate their peers about the dangers of substance use, but also educate about, the signs and symptoms of a person dealing with depression, anxiety, suicide, things like that. And then just kind of promoting mental wellness. So last year, the young people that were involved had the opportunity to educate adults on ways to market to young people. So they shared their experience, like, hey, this is what's appealing to us. This is what we like. This is what we look for. This is what we don't like. And the marketing company that the county worked with was able to create a PSA campaign based on what the young people said. Then, the young people also had the opportunity of, like I was saying, speaking at it was the Alcohol and Other Drug Abuse Advisory Council and the Mental Health Advisory Council's spring forum last year, where they had a youth breakout session, which was attended by about 100 youth, and they were able to they put a presentation together with the help of us, and then they actually facilitated and led the presentation. They kicked the presentation off with a 5-minute meditation, and led that as well. And then another thing that they wanted to do is try to encourage there's the schools within the county to do like mindfulness Mondays and wellness Wednesday activities and things like that to kind of incorporate into the schools. So last year we had about, I think we started out with like 18. We had a strong 11. And then those about 11, 7 of those 11 said they wanted to come back this year. And we're currently right now recruiting for more young people. So I'll send that flyer to Kate so she can share it with you all. So you can share it with young people that might be interested. I know we typically were recruiting high school students because we were looking at the high school students to kind of be leaders, and we have, you know, training opportunities. So the plan is to have like leadership training for them, as well as training opportunities and things like that, so that they can train other students and educate their peers and educate middle schoolers and on down to elementary school. But we actually had one 8th grader last year that applied to be a youth ambassador, and we just could not tell her she could not be a youth ambassador. And so we had her join, and she was one of the most strongest, well-spoken, articulate students that I had met. And she's eager to, you know, be back and join the group again this year. But it'll be a lot of opportunities. We meet, you know, do a lot of different things, but we really try to make sure that it's peer led, that the youth lead it, and us as adults, we just support what they want to do. So we want to make sure that they feel empowered to do. So I kind of let them know last year, like, hey, you all are the vessels to kind of, you know, make this go. I am just the financial support behind the scenes to help make sure that we can try to make this happen. So and they took it and ran with it. So I think that was great. And I'm looking forward, the county is looking forward to it this year, because we had a lot of people from MCPS and others that want to partner and help make sure that this youth ambassadors program is successful.
Thank you. So thank you all so much for joining us. I'm going to send out a follow-up email with this recording that you all can use and share with others, and the resources that we're going to get from Ben following up. But I really appreciate everybody's time. This is such an important subject, and you all and your connections in the faith community can really make a huge impact. And I really want to thank Ben for the work that he does in continuing to spread awareness about this important issue, and for spending time with us tonight. So we really appreciate all that you're doing for the county and for the community.
Thank you for having us. It was a pleasure being with you all this evening. I look forward to connecting with you all soon. Definitely lean on us as a resource, because we're just trying to educate and save as many lives as possible, and build a healthy and happy Montgomery County. So
Thank you, Ben, and thank you, Kate.
Of course. Thanks for being here. All right, everybody have a good evening.
Okay, thank you.